Hello, side dishes. Welcome to Life with a Side of Autism. I have a special guest today. It's Dr. Linda LeBlanc. Linda, welcome to my cozy green couch.
Thank you. I love your cozy green couch, and I'm happy to be here.
Yeah, we're excited to have you here. So, can you just give everybody a little intro on you in case they don't know you?
Absolutely. I'm Linda LeBlanc. I am a clinical psychologist and a behavior analyst, and I was a professor for about 15 years, and I've also been involved in treatment services for children with autism probably for almost 30 years now, and I love the work that I'm able to do with individuals with special needs, so I'm delighted to be a part of this.
Yeah, well, great. So, Linda, what I wanted to talk about today was, I think, something that a lot of families, a lot of parents with children with disabilities or autism face, that there's so many therapies out there. How do you prioritize them? And just the word therapy seems to have more than one definition. So what would you say, therapy means when you're working with a child with autism or a disability?
Yeah, so I think that's a really good question. The word therapy and the word treatment are related to each other, but they differ in some important ways. My preference is to think about ABA services as treatment for the condition of autism and intellectual disability. And much like you might take insulin as part of a treatment for your diabetic condition, you are attempting to ameliorate the condition, not get rid of it completely, but manage the symptoms and make those symptoms less present and the negative effects of those symptoms less present. And the same thing is true with ABA treatment for autism. So it's designed to address and ameliorate those characteristics of autism and to eliminate the developmental delays that are often there by establishing learning to learn repertoires and better skill sets that are going to hopefully give that child with autism a chance for a better life and a different developmental trajectory. That's different than the word that I often hear, which is therapy in terms of therapeutic. So there are a variety of things that, music therapy, art therapy, hippotherapy, and there's no evidence that these kinds of therapies alter the condition of autism, but they may well be therapeutic in that they're enjoyable. I like yoga, so yoga is therapeutic for me. It makes me happy. I'm a little more flexible. These are great things to have in my life, but it's not fundamentally treating any medical or mental health condition.
That makes a lot of sense. And so you brought it up, and we're also hearing a lot about evidence-based therapies, and I know parents are hearing evidence-based therapies. Can you explain what that means for us?
Yes. So an evidence-based therapy is one that has been investigated in multiple scientific studies and found to produce the effects that it purports to produce. So, for example, ABA therapy has been evaluated in multiple, certainly single case design studies, but also group design studies, where the ABA treatment condition is compared to either some eclectic, multimodal, little bit of this, a little bit of that treatment, or a delayed treatment condition. Those are not in favor, obviously, because now we do know that there is something that works. Waiting for that isn't something we want to do with children with autism, but those studies begin to produce an accumulation of an evidence base. So each piece is a bit of evidence that is over time accumulated together, often in something like a meta-analysis, where we've looked at the 10 studies that have done these kinds of comparisons, and that tells us kind of what the the volume or the amount or the strength of the evidence is. So ABA is an evidence-based therapy, meaning that there is strong evidence that when ABA treatment is delivered early and intensively, we see a significant improvement for about 40 to 60% of kids, depending on the study. And we see substantial improvement that doesn't fully ameliorate the developmental delay or the autism condition for another 20 to 30% of kids. That is, their lives, their repertoires, their symptoms and characteristics are significantly better than they were, but they are not indistinguishable from children who were never diagnosed. So that's really what evidence-based means. And I'm also a mom, and when I think about whether I want my child to experience something as a treatment, my child actually has a tic disorder. There's one significantly evidence-based treatment for that, and it's also behavior analytic. Well, that's what we do, because I don't want to waste time that could be put into something that's been shown to work into something that has not yet been shown to work. Maybe one day we will have that evidence, but we don't right now, and I'm making decisions for my life and my child right now on the evidence that exists right now.
You said ABA is an evidence-based therapy for autism. Are there other evidence-based therapies for autism?
All of the therapies that have been designated as having enough evidence to meet the criteria for evidence-based therapy are primarily behavioral. So there are other versions like pivotal response treatment, which is a behavioral therapy. At this point, the Surgeon General's recommendation, the insurance mandates, they all focus on ABA therapy. Now, that is not to say that other therapies such as speech therapy or occupational therapy are not useful. Children with autism we call the condition autism, but the fact that you have autism doesn't mean that you're not going to also have some fine motor difficulties. You're more likely to have fine motor difficulties or gross motor difficulties. Or I've worked with clients who also have cerebral palsy. Variety of different things that physical therapy, occupational therapy can all be very useful for. Similarly, language is one of the core deficits of autism, and so speech therapy services can absolutely be tremendously beneficial. Speech therapy services are usually provided in more of a low intensity service model, 1 to 2 hours of speech therapy per week, and that's kind of used to assess and make recommendations for the things that could be practiced. However, children with autism tend not to benefit if only low intensity services are provided. And so when you have a speech pathologist and a behavior analyst that can work together to take that knowledge base of the speech pathologist and then incorporate that into the ABA therapy, along with all of the expertise associated with behavior analysis, you tend to end up with some pretty exciting models. One of the ones I really like is at Therapeutic Pathways, where the two owners of the organization are a speech language pathologist who's also a BCBA and a BCBA. And I think that those kinds of things can be very beneficial.
And a BCBA, for those who don't know, is a board-certified behavior analyst. So you touched on it a little bit, but let's talk about all the therapies. A family gets a diagnosis of autism. They hear, like, there's ABA therapy, there's speech therapy, there's occupational therapy, there's art therapy, there's music therapy, there's horse therapy. Where should they spend their money? And I've actually had families...
And their time.
Yes. And again, time and money are limited resources. And I've had families actually call and say, I've got $200 a month. Should I spend it towards ABA or should I spend it towards horseback riding therapy?
Yes.
And I say, well, I think you should go with ABA. Here's why. Again, all those therapies, how can families choose and decide really what's the best versus what's their child maybe enjoys one more than the other? How would you help? How would you guide a parent?
Well, I try to always be mindful of the fact that I actively chose to get into this field, and I invested a whole lot of time and money and effort on the front end to get my PhD, and I've always worked with people with special needs. I chose that, and the families of children with autism did not choose to have autism in their life. So their curiosity and eagerness and excitement is not, that's mine. What they are experiencing is very different. And while I've spent my career learning to sort through all of these different things that are out there, they're brand new to it, and they're sorting through those things is affected by the fact that they've just had information delivered and into their world that's so different than they expected, and they're wondering, how is this going to change the future that I envisioned? So when I talk with families, I mention, you're probably feeling this way as you're going through this information, and you want to be as calm as you can when you make those decisions. That's easy to say and harder to do, but anytime you're making decisions about time, money, resources, you want to try to be as calm and objective as you can, which is why evidence and data can be helpful. Somebody's already done some of that sorting for you in terms of, is this a good buy, so to speak, for the time, effort, sweat, tears, driving around, finding a provider, so much associated with that. So I think of it this way. You want to put the vast majority of your time and effort into the thing that has been shown to work. And that's ABA therapy. So I think like you're saying the right thing when you say that to that mom. One of the things to keep in mind is in some of those earlier studies, one of the control conditions was a little bit of everything. A little bit of speech, a little bit of OT, a little bit of PT, a little bit of special education, early intervention class, and that doesn't work. That was the control condition. That was the thing that was compared to ABA, that ABA worked so much better. That's part of that evidence base. And that's not readily apparent unless you've dug into those studies like a science geek like me has. Mm-hmm. So that notion of like really go all in on the thing that has a chance to change your future. And you may well add on a bit of speech, a bit of OT, a bit of PT, but it shouldn't jeopardize your access to services that are going to really maybe be transformative in nature. Now, there are therapies that are reasonable for a certain scope. For example, if a child has some food refusal, feeding problems, that kind of thing, which is somewhat common in children with autism, you are absolutely going to want to get a swallow study. You're going to want to look at that oral motor functioning. There are both speech and occupational therapists who specialize in that. You need access to that, and that needs to be incorporated then into a treatment approach that's primarily, again, going to be behavioral because that's what's evidence-based. There's a whole batch of things out there that are not that. Instead, they are what we might call fad or trendy or alternative treatments, CAMs they're often called, alternative medicine. And to be honest with you, there's not only no evidence to support those, there can sometimes be evidence of harm. And that's where we really want to help families kind of see that, that difference. This is the wheat and the chaff, and it's got to be separated. So, for example, there are, much like there are many, 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 many studies that have now shown there's no relation between vaccines and autism. Please vaccinate your children. There are also studies coming out that show auditory integration training does not produce effects for children with autism. And you pay a ton for it. Paying more doesn't make it more effective. Period. It doesn't work. Similarly, there was a recent study that's come out that the gluten, casein-free diet does not produce therapeutic effects for children with autism. If The child also has celiac disease. That's a whole different ballpark. That's what that gluten-free diet's designed for. But the GFCF diet as a treatment for autism has no support. In fact, the evidence says it doesn't work. It's not just that it hasn't been studied yet. And there are nice resources that parents can go to that help them know, is this kind of like there's studies and it's looking promising and we just need a few more studies, or are there studies saying this is not this? There are multiple studies that show facilitated communication does not have the effects that it's purported to have. So those kinds of things are these kind of fad, almost sham therapies. And again, when you think about the families of children with autism and kind of what they've just encountered, they're vulnerable. They're vulnerable. They want that miracle, of course they do. And so we have to help families be in a position to try to make the wisest choice they can from that position of vulnerability. I particularly like the Association for Science and Autism Treatment as a website. Have you ever looked at that one?
Yeah, I used to be on their board, actually.
Oh, well, then you tell us about it,
Yeah,
Mary.
well, it's asatonline.org, and it's not for profit, but it's a great resource because you can go, and just look up any type of therapy, sand therapy, dolphin therapy, and they'll tell you all about the research, if it's proven, if it's emerging therapy, or if it's just doesn't work and downright harmful. So again, that's a really good resource to go and evaluate therapies. It's looked at by really smart people, smarter than me, but who really go through and look at all the evidence. And sometimes there'll be a research study that comes out and says this works. Well, these guys will come in and say, well, it's saying it works, but the whole study is basically flawed, and here's why. So can't really, consider this evidence-based, and here's why. So it's a great resource. So it's asatonline.org.
I really like that as a resource. What I caution parents against, and I think about I do that for other, I needed to get some little booties for my dogs. I Googled that. Amazon, what have you got? Oh, look at that. It's not the same, right? I wouldn't Google and Amazon for a treatment for any kind of condition like autism or any other medical condition. Stuff's out there. Being out there and marketing is what gets things on Google and Amazon. Careful science is what gets things in the evidence base and on the website of an organization like ASAT or approved by the Surgeon General of the United States. That's a different source of information. And what I love about ASAT is they're looking at that scientific evidence and making it easy for parents so that you don't have to become a knowledgeable expert about the scientific investigation process and all of the studies that have been done for autism. ASAT's kind of doing that for you.
Right.
There's also, for those of you who like textbooks, like I do, there is a book out there by Jim Johnston, and I'm blanking on who his co-author is, but it's on fad treatments for autism. And there's a chapter on every one of these: sensory integration training, auditory integration training, the gluten, casein-free diet, the injections were chelation. There was the bovine hormone injection that was very popular for a while. And the thing is, they really reach this word of mouth peak and then they plummet and then they come back with a new name. Facilitated communication, rapid prompting. It feels like whack-a-mole from the perspective of scientists. Wait, we just proved to you that you're a quack under that name, and now you've appeared as a quack with a new name, and I have to prove you wrong again. And people are vulnerable, and it kind of offends the sensibilities of those of us who see how much marketing effort is put into grabbing the attention of parents who are diligently trying to make good decisions about their child's life and they're kind of being fed some bunkum. And the fact that there's a cycle that's been observed, that they reemerge, it's like, oh, well, you forgot. And now here we are again, and we can charge you money for something that doesn't work. It kind of goes through. What are all the ones that keep showing up? Just don't be fooled when it pops up a second time. And second, how can you think and respond to whatever it is that you're encountering in a way that's just kind of skeptical and science-minded?
So let me break in there. We hear about evidence-based therapies and treatments, and then we see the evidence that, the gluten-free, casein-free diet doesn't work. But there are so many parents out there that swears that it works. And so you're a parent of a newly diagnosed child with autism, or you want to try it, and you've got, like the evidence that says no, but you've got all these parents over here that are saying it worked, it totally, within a week my child was talking. And that is so compelling. It happens for everything. Facilitated communication. There's all these parents that swear that it works. And so it's hard not to get sucked into that. Like, maybe that is the one thing that's going to unlock my child's potential. I have to try it. So, and again, that's just anecdotal
testimonials.
Yeah, it's really not even the research, but it's just anecdotal, but it's so powerful versus this very dry piece of research.
I know.
So
science isn't sexy.
Yeah, so what's a parent to do when they hear, well, this family said it changed their life?
Yes.
But you're saying it's a fad. Like, how do you, it's like a paradox. How do you resolve that?
How do you do it? I'm sympathetic to the fact that that's the reality of life when you're the one trying to make the decisions. And so a funny thing has been shown. I'll kind of turn to the work that's been done on facilitated communication. And there have been multiple studies shown, like people who absolutely believe that they are changing the life of a child with autism, unlocking their ability to communicate, and they feel just as good about what they do as I do about what I do. Then what the study shows is that when you show, let's say, one picture to the facilitator and a different picture to the child with autism, and they say communicate about it, the only thing coming out is what's being shown to the facilitator.
Yeah.
And
in that study, it was 100%.
100%. Like
100%.
When I say the only thing, I actually mean 100%. The only thing.
So, like, say
Yes.
the facilitator gets shown a key, and then the child gets shown a dog, and then they say to the child, type in what you see. The child is typing in key, but they didn't see a key. So,
yes, absolutely.
Yeah.
And there have actually been multiple studies.
Yeah.
And it's often crushing to the facilitator who's absolutely believed that what they were not influencing this child's. They thought they were allowing the child a voice that they never had before. So you can be fooled in the activities of your own life, It's not good people or bad people or good intention or bad intention. There's certainly some of that. Perfectly lovely, kind, well-intentioned people can be fooled into thinking that there is an effect when there is no effect. And science isn't going to be fooled that way. That's where that objectivity, that close measurement at multiple times comes from. You can feel like Brussels sprouts make you healthier, but ultimately your doctor's going to look at your med tests and they're going to say, but what else have you been eating? And when you're eating those Brussels sprouts, are you thinking like, I'm on a health kick? And did you walk a little more? And there tend to be all these things that can co-occur at the same time. So even these parents who say, I gave my child vitamins and then they started to work, maybe also were doing some other things at the time, or the language emerged at that time and it would have done so, whether the vitamins or the injections or the gluten-free, casein-free diet, whether any of that would have happened. So what science is about is making sure that it's the thing that we really think is causing the effect that's really causing the effect. So, If we think, it's Brussels sprouts, it's this diet, then everything else is held constant and only the diet changed. Or if we think it's the diet along with whatever, a heavy blanket or weighted blanket, then those two things get changed, and they're the only things that get changed. And when that kind of a skeptical, I'm willing to hear it, but you got to prove it to me approach is taken, it often becomes clear that people have anecdotes and testimonials about things that are influenced by their perception. 4 out of 5 dentists surveyed do say this is a fantastic toothpaste. Mm-hmm. That's not quite the same as having scientific studies that actually look at the porousness of your enamel. Thank you, dentists. I'm glad for your opinion. I'd also like to see the science. That matters less when you're talking about toothpaste than it does about a treatment or a lifestyle choice that you're making for a child with autism. And what I always worry about, let's say with something like the gluten-free, casein-free diet, there's been no evidence that it harms people who pursue that diet. But it's also tremendously effortful for the family. And it introduces some worry of like, oh my God, did he have a gluten or a casein or a who knows what? And it almost kind of puts you in this position like many families have when their child has a nut allergy, except you don't have a nut allergy. Right. You're choosing to introduce this and eliminating a lot of flavor and other things for something that might not harm your child but isn't going to help your child. So there's a drain on,
and it's an expensive,
the life resource.
It's an expensive diet to follow, and I find that kids with autism oftentimes have a really restricted diet. Now you're restricting their diet even more.
Yes.
And there was a paper out about just vitamin deficiency and bone health with children who were put on the diet early. I wanted to add, the new facilitated communication, it's Saved by Typing. That's their new
that's the new name. The alert, folks.
Incarnation.
Here is another one, just like the other one.
Yeah.
It just has a different name. And that's what's hard because, families kind of my career has been a 30-year stream of these things, and I see them come around again. But for a family with autism, they're entering midstream. And it looks new to them, and they haven't seen the hubbub unless they enter right at the peak of a debunking study saying, no, this doesn't work. And, the FDA cracks down. And the FDA has just cracked down on some alternative medicines for autism just in the last year. So if that happens to be when you get your diagnosis and you see FDA warning, you can't say that this is a treatment for, I think cannabis is the one that's been most CBD oil, where they're claiming it's a treatment for autism. And there's absolutely no evidence for that. But, you claim anything you want until the FDA comes to get you.
And people are making a lot of money.
And
just the hopes, yes.
That is exactly right. And so if you're a parent, you're thinking about it, you've got to keep in mind, why is someone marketing this so hard? Money, and especially if they're marketing it based on testimonial. Like if they had science, they'd market it with that, right? They don't, and so what they're left with is a family who's had a positive experience saying that I've had a positive experience, and maybe very enthusiastically, right? Because they're happy, and that's great, but it doesn't mean that other families can expect to have an effect. That's the part that gets lost when you're looking at testimonials and anecdotes as your source of decision making.
I think one of the traps that parents fall into is just, we want a pill, a shot, we want something fast to cure autism, and we don't even know what causes autism. We certainly don't have a cure for it, but the idea of taking some oil, or, going and riding a horse once a week. Those are just easier things than the intensive treatment that we have to do with autism, which is usually 5 days a week. It's intensive, it's effortful, it's hard work. And again, we are always looking for that easy fix, and there is no easy fix. It takes hard work and good therapy, and it could take
a lot of it.
Yes, and it could take years. There's no magic drop for it yet.
Well, and I think that you really hit the nail on the head. That's why these other ones keep popping up, because wouldn't it be fantastic if you could just buy a device and then your child could talk and they were actually typically intellectually functioning? You can't. But wouldn't it be wonderful? And doesn't that seem appealing? And it is so much less effortful. Oils, pills. I'm not sure the diet is less effortful, but it certainly doesn't work as well, And so the way I encourage families to think about it is, please do not jeopardize the one thing that has been proven to have beneficial effects. Go all in on that. And if you want your child to have the experience of riding a horse, lots of kids enjoy horseback riding, and so let's do that.
Yeah.
But don't cancel your effective therapy for what functionally may be a leisure activity.
Yeah, like maybe music therapy or art therapy.
Exactly. I like music.
Sure.
I like art.
Yeah.
And the couple of times I've ridden horses, I liked that too. To be honest with you, even like the, weighted blankets, if that feels comfy, cozy, that's wonderful. Just make sure you're not providing that kind of stuff contingent upon problem behavior, and don't expect it to make your child dramatically different. Other than momentarily happy. And you know what? Momentarily happy is also quite nice.
Yeah.
But first, do effective treatment.
Right. I think our last question, just in closing, parents are, they go to the school district, and the school district says, we have this early intervention program, we've got this, we've got inclusion, and then you go to an ABA center and they say, we have this, we have intensive therapy, and then you hear people say, your child needs to be around typical peers, and, they get all this different information. So how should a family look at school versus an ABA program? If they had to make that decision, should I go the school route, or should I go like the ABA treatment route?
The majority of the studies that have shown the biggest effects are for early intensive behavioral intervention. So that means early diagnosis matters. And if you have a child that's kind of in that range of age 2 to 6, maybe 2 to 7. That is very similar to the children in these studies. There is evidence for ABA therapy after age 8 that still produces good effects. But particularly if you have a child between the ages of 2 and 6, do the thing that works. So again, keep in mind, a school-based, eclectic, early intervention model that's not early intensive behavioral intervention was a control condition in the studies done by Howard and Sparkman.
It's 2004 out of UC Stanislaus, and then there was a follow-up paper in 2015.
That's right, looking at the long-term outcomes. So what your school can offer probably is closer to that control condition model. Now, there is absolutely benefit of being around typical peers, and most ABA programs should have an opportunity to facilitate that. And so, I do like center-based programming at least at some point. You may start with home-based programming, but center-based programming and having even other children with special needs to partner with, to play with, that kind of thing, is beneficial when you're working on social behavior, which is another core deficit of autism. So try to get that within your ABA rather than substituting that for your ABA.
And I think people just forget that our goal, we're always working towards getting the child into the school. So
yes,
because
that's
they
exactly
don't
right.
start there doesn't mean they're not going to get there.
That's
but,
right.
They've got 12 years to I was going to say 12 grades to be in school, but actually, if special needs, they can stay in school to they're 22.
Yes, so you could be looking at 14, 15.
Yeah,
yes.
So that's always our goal to transition the kids into the school where they can be more successful. So.
That's right. And I think all of these studies, one of the things that they look at, one of the goals of early intensive behavioral intervention is to prepare the child to succeed in the typical educational environments that are going to be available to them. And that might involve some amount of special education services. When I say treatment effect, the treatment effect is what's often looked at is how many of these children are able to succeed in a regular education classroom with some additional support, special education supports, or a less intensive special education setting, and have stronger skills and abilities and a greater number of social interactions and quality of life. So I think that the notion of go all in on that therapy that's going to prepare the child to be able to better succeed from that educational environment once they're in it is probably a better approach than putting them in that control condition that is not shown to particularly increase their readiness for the rest of school.
I always kind of think of it as, if you have a child with a disability or autism, it's probably better to overreact than underreact. And if you put a child in an ABA program and then they don't need it in a couple of years and go to school, it's not going to hurt them. You're just going to have a really smart kid.
I like having a really
smart
kid.
So it's just gonna give them a head start. So Linda, thank you so much for being here and
chatting with
us, and thanks for joining us. And we post autism related videos every Tuesday. We post lifestyle and other side dish videos on Thursdays. So be sure to subscribe, ring the bell, and you'll know every time a new video is uploaded. Until then, be good to yourself. Goodbye.